Well, some of the exciting things that I'm seeing in the industry that's happening right now, for instance, there's 7 new clinical trials that are underway that is looking at different modalities of providing breastfeeding support to women. And the reason why I say that this is exciting is because historically, thinking about this type of specialty has been just generally underfunded and under-researched. And so when you can look at the research and understand how incredibly important it is to have these types of services, it helps to steer policy, and policy helps to create things like reimbursement structures. So that's really important. The other thing that I'm seeing just kind of in the industry at large, when we first started our organization, we were only one of 3 organizations that were providing tele-lactation services. And when the pandemic came, the conversation used to be, why should we have telemedicine? What's the use case for telemedicine? But what we're seeing now is hospitals, payers, patients, even physicians, that used to kind of have a more trepidation into using this type of service, they recognize how needed it is. And so the conversation really is, how can I get this now for every specialty? And so we're seeing organizations do what I'm passionate about, is truly clinical integration. So we're seeing hybrid models of care come out, which is, I think, for a specialty like ours, is really important, because sometimes we are the triage of care for this instance. We're preventing more complex issues from occurring, such as hospital readmission rates for infants, but we're also the connector for those patients that really do need to be seen by a particular specialist. And so we're helping to make sure that they get connected to that next level of coverage, while still being able to provide human milk for their babies.